Hello everyone, my name is Marcus Ofosu Apia. I'm a student of National University, and this is my reflection paper for the internship that I did here at Naval Medical Center San Diego. This is to fulfill my internship reflection paper requirements from my Master of Public Health Education at National University. In this video, I'll talk about three foundational knowledge competencies. I'll talk about three workforce domain competencies, and I'll also talk about two public health competencies that I achieved during my internship and the day-to-day work that I do here at the Naval Medical Center San Diego. So let's get started. The first foundational knowledge competency that I achieved here is to design a population-based policy, program, project, or intervention. Let me quickly say that before I actually started my internship, I had completed a few courses from National University, and my experience working as a hospital corpsman and my volunteer time that I did with some NGOs, both in Ghana, in Africa, and here in the United States, in Texas, and in Pensacola, here in San Diego. So before I actually started this internship, I had some experience about program development, planning, and intervention, but I was curious as to what more I can learn from a different environment, especially an environment that is engaging and where you have more responsibility, and you'll be able to make changes and make decisions when they are very, very essential. So the two documents that I have verifying this achievement, the achievement of this competency, are one, fitness enhancement program design, and the second one is developing an intervention for yellow fever vaccine shortage for our military population here on the West Coast. So I will start with the fitness enhancements program. So here at Naval Medical Center, one of our mission is to support our military population. A big issue that we have now is for people in our military population who cannot successfully complete their physical fitness test. So what we have to do is we have to develop a program that will help these people who are struggling be able to finish their physical readiness testing, so they don't get kicked out of the Navy. Let me add that the Navy has a policy that if you fail 2 PRTs in a 2-year period, you are going to be kicked out of the Navy. So it is very important that a program is instituted to help those who need help in becoming better at their physical fitness. And so I was one of the guys who actually dedicated our time, went through the training, and we were certified to implement these programs. What we did was we designed programs that are targeting the people and their needs. Some people won't have issues with the run, others have issues with upper body, others have issues with the core. So because they are different people with different requirements, we cannot integrate all of them and train. What we do is we have to separate them according to their needs and develop a program that is best fitting their need. One program that I designed was a run program that is actually, which I call a run clinic. What we did was we designed a circuit with six cones and a few obstacles. So what we did, you start the run at the point. We help you manage your breathing. We help you manage the steps that you take, how you step on the ground, how you actually, your body movement, your motion, your speed, how to control your breath, and everything like that. And so we found out that this program was very, very, very helpful, especially during the first time that I started this. I started partaking in this program, I doubted if people who actually went into it actually were able to do better. But I went into the program, and I realized that this is very, very helpful, and it's able to get a lot of people off the what we call fitness enhancement program list, and subsequently perform better in the Navy. So that is one of the programs that we designed. We designed a program to suit our population, those who need help with the fitness program with fitness. We help them. Some develop nutritional guidelines for some of them. Some we also develop a weekly weighing process to help them manage their weight. Some we also develop a 3-day in a week training regimen to help them get better at what they are not really good at, and a few other programs that I cannot enumerate. So it is very important that in being able to achieve this competency by developing a program, project, or intervention using a fitness enhancement as an essential part of a military population is very important in achieving this competency. The second document that I have verified is the intervention we developed for yellow fever vaccine. Here at Naval Medical Center Immunization Programs Division, one thing that they do here, I said we because at the period that we were doing this intervention, I was part of them. But one thing that they do here is manage all the immunization program activities here in Naval Medical Center and 19 branch clinics around here in the West Coast. This includes the MCRD, the Navy Recruit Depot. We also have Special Forces coming in. We have the Coast Guard. We have a few other military populations, especially dependents who are traveling to places that are yellow fever prone. So our role here is to make sure that the yellow fever shortage that was coming, we have some alternative for the population that we are serving. Even though we use the programs manager explained to me that they use special government approved manufacturers who produce for the yellow fever supply, it was important that at this time that our suppliers were actually going low on supply, we should be able to find some alternative to meet our military needs, especially for those who are getting ready to deploy and those who are going to the recruit stations. So what did we do? The first thing we did was organize a meeting. So they had sent messages. Apparently they have been communicating about this shortage for about a month or two. So everybody who is managing the immunization program in their various clinics know that this was coming. So it wasn't actually a surprise to call for a meeting at this time and to look for the way forward, finding an intervention for this shortage that was coming to hit our military population. We organized a meeting. Those who couldn't come physically joined us via VCT, the video technology, video conferencing technology, and we were able to come to a consensus. So what we did was we contacted the Army because they have a very big public health department, and they were able to give us some options, even though it was some of them were more expensive than we had anticipated, and more expensive than the government had actually approved for our spending. It was very important that we were able to adjust our spending to take care of this vaccine shortage right now until our suppliers are able to give us the quantity that we need for our military population. So it is very important to note that developing an intervention for yellow fever vaccine is very paramount to our military operation and paramount to any program development and management anywhere. So this competency actually is one that I actually learned a great deal about teamwork, about coordination, about communication, about working together, working under budget, yet being able to move things around to suit to achieve a goal, uh, however important, within a budget that you have been given. So it is very important, and I very much appreciate the coordination and interaction that existed between all these parties. So it is very important to note that achieving this competency was really something that I learned a great deal out of. Okay, so now we come to the second competency in our foundational knowledge, which is perform efficiently on interprofessional teams. So what did I do to achieve this competency? The first one, I'll point out my role in educating a splenectomy patient, which involved different categories of persons or specialties, doctors, nurses, public health professionals, hospital corpsmen, in educating a patient who was diagnosed with a condition they call idiopathic thrombocytopenic purpura. Simply put, your spleen is not good, so we have to take it out. And mostly what providers recommend is that they let me put it this way. Splenectomy is the surgical removal of the spleen from the body, and you know what the spleen does? It's an organ that helps fight infections and filters unwanted materials like dead cells, damaged cells from the body. So if your spleen is not working, all these damaged and dead cells will accumulate somewhere in your body and start causing some other problem. In such a case, what they do is once they take out your spleen, your body becomes immunocompromised. What it means is that you have to go back and take the vaccines that were given to you as a baby. So it's basically becoming a baby all over again. So you start with the vaccines, everything all over again, and then you stay through the cycle until your provider, after constant checks, realizes that you are good to go for a period that you don't need any vaccine. So what did we do? One, explaining splenectomy to a patient is sometimes very confusing. Sometimes they don't grasp the concept of them not being able to fight infections, even at their age, and that they have to take vaccines for kids, as we may call it. That is what it is, vaccines for kids. But it is important that we work together with the people that are giving care to this patient to be able to understand. So this started even before the patient went to the OR. We went in there as immunizations program division with my preceptor, and then we met the family, we met the patient, and we explained, we gave him all the vaccines that the patient need right after surgery, and subsequently during the first few months, and subsequently as the patient goes on without the spleen. The patient understood. The doctors came in. The doctors, we had already spoken to them. They all know the process. They know the procedure. So now they also have to just keep talking about the same things in their education with the patient and with the patient's family. So we know that we are on the same page. And then right after the surgery, we also have to teach the patient how to take care of their wounds, post-surgical wounds. Also have to take care of the other vaccines that are coming, not to miss a deadline for a vaccine shot that they need to take, and what they actually need to do to stay healthy. So this was a correlation between the doctors, as public health or immunization programs division, and the nurses, the patient families, and the patient. And so look at the interrelation that existed between all these groups of people that were involved in the health of one person, in one instance, in one condition. And I after this competence, after this internship, I was very, very pleased as to the teamwork that exists between different parties that aid in helping one person achieve one goal at a certain time. Doctors, nurses, hospital corpsmen, public health professionals, preventive medicine techs, and all these people who come into play in one instance to help one patient stay healthy. And that is what I believe public health is all about. It doesn't matter the resource that you have to put together, so long as it helps in aiding the population at any time, then it is worth doing. Okay, so the second evidence that I have for achieving this interprofessional team, performing on an interprofessional team, is the knowledge element for adenovirus type 4 and type 7 vaccine administration. So this is a routine training that we give to people who administer adenovirus. For those who know, adenovirus is a live virus. So it is very important that if you administer this medication, you know what kind of education you give to the patients who come in for this patient for this vaccine, especially those in MCRD, those recruits living in close proximity to people and taking adeno vaccine can be very, very, very tricky and can pose a lot of health problems if you don't educate and obey certain practices. So what we did here is we called the providers, those who administer the vaccine, and we retrained them. We retrained them. Our role here was to make sure that they know the procedure, they follow the procedure, they know the things that to look out for in case of any unforeseen circumstance that comes as a result of the vaccine that they've administered to a patient, and the things that they actually need to look at. So this is a coordination between programs management from Neva Medical Center to all the branch clinics, to especially the recruit depots. We talk about doctors here, we talk about hospital corpsmen, we talk about civilian providers, public health officials, social workers, all these people that come together to make sure that one program that we have that is working efficiently will continue to work efficiently. And that is interprofessional teamwork that we achieved during my internship here at Neva Medical Center, San Diego. Competency 3 under foundational knowledge is communicate audience appropriate public health content, both in writing and through oral presentation. So this will take us back to the splenectomy patient that we were talking about during our teamwork, our interprofessionalism competency. This will like piggyback on that particular activity or that particular situation, anything like that. So this one here, I have to document. The first one is the education materials that we provided and the education that we provided for this splenectomy patient, and the second one is immunization and pneumonia immunization clinical quality team minutes that we developed, and I'll talk about those two momentarily. Sometimes it is important to know the audience that you are dealing with. It makes your work very simple. It makes sure you are talking to the right people, and it also gives you the confidence that what you are talking about, your audience can follow and can understand. And that is what this competency is about. What we did in the first instance with the splenectomy patient was a patient who was affected by a condition, and the way to get the patient healthy again was to undergo this procedure. To be able to understand this concept of splenectomy, or concept of you becoming a baby one more time and getting all the immunizations that you need, you have to be in that condition to be able to understand this very well. So the audience here is the patient and the patient's family. And our role at that time was to educate this patient to know that splenectomy, when you have splenectomy, when you have the procedure, after the procedure, these vaccines need to be taken. You have to get all these vaccines, and you have to do adhere to certain lifestyles, for the first few days or weeks, months that you have undergone the procedure, until you are healed, and then you continue with your vaccination or immunization regimen. So it is very important that the audience that we are communicating to understand what you are talking about, and it makes our work very, very simple. And that is what happened here. Our work, the patient understood what we were talking about, the patient's family understood what we were talking about, and they were ready to actually go ahead and do the things that we were recommending for them to do, and it was very helpful. The next thing was pneumonia immunization clinical quality team measures that we actually developed for those persons who administer pneumonia vaccines. So as it were, for the providers who administer pneumonia vaccines, it is important that if there are any updates, there are any new information about the vaccine administration, you are able to communicate to the appropriate audience, so they will be able to carry out that activity appropriately, because they administer the vaccines, so they know a lot about the vaccine administration. So if there's any improvement, there's any new update, they should be informed, so at least they'll be able to keep up with the new trends that is going on. And that is what we did here under this competency. What we did was we called for a meeting, and the evidence that I have here is actually the minutes for the meeting that we had with the immunization program administrators from the clinics that we were dealing with. Even though I can't go into the details of what the minute actually contains, it's important to say that we updated their SOP. SOP is standard operating procedures for anybody who will administer this vaccine. So what we do is, if you have the vaccine, before somebody can administer this vaccine, we have to be sure that this person understands what he or she is going to do. So that's what we call SOP. It's a list of things that the person must show and get checked off by somebody who knows the process, especially a programs administrator, a programs director, or a senior personnel who has undergone this training, who administers these vaccines and is certified to be a pneumonia vaccine administrator. So once the person finishes this SOP, then the person will go under monitoring, and then the person will start administering this medication. So by the time the person is able to administer this medication, he has gone through a lot of checks and balances. So this person actually knows that this is what they are doing, and that is what we did under and for this meeting. What we did was we developed a new SOP and presented this SOP to the people who are administering this medication. So I guess it achieves the competency. We'll go on further to the workforce domain competencies. The first one is to contribute to the public health evidence-based, participate in public health practice-based research network, community-based participatory research, and academic health department can author articles making data available to researchers. Let me start by saying that now artificial intelligence is becoming very paramount. It is everywhere, and now artificial intelligence is getting into public health. My role in my effort in achieving this competency is a program that we actually were enrolled into by the Surgeon General of the United States Navy. It's called Digital Vanguard, and what we do is we try to leverage artificial intelligence, machine learning into healthcare, into medicine, into public health, into preventive medicine, to make sure that we are making the best out of the technology that is coming up. So the evidence that I have here, one is an agenda from an artificial intelligence in healthcare summit that I attended in San Francisco, and the other one is a PowerPoint developed from that summit, that artificial intelligence summit. And this is focused on improving the health of population. This is people from all over healthcare. We have Dell, we have Apple, we have Philips, we have IBM Watson Health, and these people are all undertaking different aspects of improving the health of population with artificial intelligence. And it is important that all these people, including the private and public sector, come together at a certain point to discuss the new trends in artificial intelligence, the new things that they are doing from different angles, to be able to tell the world that this is what we have found, this is what we are doing, and this is how far we have gone. And that is what this agenda is about. This summit was about improving public health, improving global health, looking at especially one thing that I would like to mention over here that IBM Watson is doing is what we call a cancer monitoring program, that they've developed an artificial intelligence program or a machine learning algorithm that is able to detect and help providers know how much chemotherapy they have to give to a certain patient with a certain category of cancer, or at what time to start chemotherapy, and how much they actually need. So we could see where artificial intelligence is coming into healthcare to help in educating or in help making people better. And through all these chronic diseases, diabetes is there, you have cancer is there, we have smoking, which is a big issue that people don't see. It is dangerous, but it is, and a few other things that is affecting the health of populations that different entities are coming together to work on. The second one being the PowerPoint are things that we actually developed after the summit to use to educate the people that we work with, the teams that we work with, to let them know. It's like sharing what you've learned. So you learn something from a summit, and then you share with other people. That is what the second one is about. The second competency at the workforce domain is to describe ways to improve individual program performance. The first one that I'll talk about is I'll go back to the SOP for the pneumonia vaccine immunization. So what we did here under this competency was to describe ways that we can improve this SOP to meet new and improved requirements, new and improve how do you call it, interventions for people who come into the clinic and have this vaccine. So we have, the Navy has standards, the Navy has their policies that is updated frequently. So once we have the update, we go into the clinics that are actually administering these vaccines and we educate them. And that is what the immunizations program division here at Naval Medical Center San Diego does. And I was happy to be part of this program at this time, that they organized this SOP revamp or SOP improvement project that yielded a great deal of results for people who are actually administering the vaccine. Okay, so the second evidence that I have for describing the ways to improve individual program performance here is an FRI outcome, 2007 outcome. FRI, for those who do know, is febrile respiratory illness and surveillance program. So the Naval Medical Center here, the research center here, has a program that actually monitors Every time when there is a flu, we have a program that monitors how many flu vaccines are given out, and then we can compare it to the previous years and the years before, and then we can also compare the number of flu cases that we get during this period and see how effective our vaccines and our programs are actually going. So the FRI programs outcome that we have over here is to monitor the vaccines that we are giving out to the people who need it seasonally. We know flu is a seasonal vaccine, so you get them every season. So we have to be able to tell how many people got a vaccine, and we can compare to how many cases of flu we actually reported, and then based on that we can make improvements and make things better for our military population. The next one here, I'll go to the competency number 3 and the workforce domain, and that competency is to contribute to the development of a vision for a healthy population. Contribute to the development of a vision for a healthy population. Let me start here by saying that a healthy population, developing a vision for a healthy population comes from you having the right knowledge and the right expertise to be able to do so. The first thing that we did, and that the first thing that I did to achieve this competency was to undergo a command fitness leader training, which will give me the skills, the knowledge base, the ability, and to certify me as competent to be able to administer this fitness enhancement program throughout the Navy for personnel who need this kind of service. So how do we do that? How do we develop this program? The first thing that we do here is to identify the people who need help. How do we identify the people? Twice every year, the Navy conduct what we call fitness. How do you call this? PFA, okay, physical fitness assessment, or some call it PRT. All these things that we do is to make sure that our military force is in a good condition. We are healthy, we are strong, and for those who are not healthy, who cannot meet the military standards, we'll help them to get better, unless you don't want to be helped. In that case, well, then you'll be kicked out of the Navy. But for those who need help, we'll go ahead and help. And that is our role here as command fitness leaders. We plan fitness programs, we monitor people's weight through weekly activities. We also develop training regimens for people. For those who need nutritional guidance and directions, we have nutritionists on board every Naval Medical Center that we work with, so then we call the nutritionist in, and we're able to develop a nutritional plan for such people. Whilst they are undergoing that nutritional plan, we as fitness leaders, we also go in there, team up with this patient, this personnel, and we are able to help these people transform from the condition that is not very healthy to a more healthy condition that helps them perform better on their military assignments. The second thing that I did over here was to contribute to the yellow fever vaccine shortage that hit Naval Medical Center and the branch clinics, and the interventions that we took to make sure that we have enough vaccines for our military population. So in my contribution to the development of this healthy population was to give options, to give guidance, attended the meeting, give guidance, and then we all drafted the information that we need. We made some phone calls that we needed to make sure that we have the information that we needed, and we also team up with other people to draft the intervention, to get the requirements, and most importantly to get the funding for it, because the vaccine that we get from the regular manufacturers are priced so well that if we are stepping out of that, we'd have to spend extra to get these vaccines from different manufacturers because we don't have any contract with them, and it makes this very difficult. So to be able to contribute to this healthy population, you have to know what the population needs and develop the program and intervention that is necessary for the program for the people of that population. All right, so now we'll go to the two MPH specialization competencies. I can't talk. Two MPH specialization competencies that we achieved during my internship and during my work here as a hospital corpsman with my duties and assignments. So the first competency here is to conduct evaluation related to the health, related to health education. I'll conduct evaluation related to health education. What did we do? Okay, so the first thing here is to look at the first competency documentation that I provided here is one, an evaluation of influenza season report, education points and updates here at Neva Medical Center, San Diego. So the first one that I talk about being FRI, febrile respiratory illness surveillance update, was for the entire West Coast. That is conducted by Neva Health Research Center. This competency that I'm talking about here is only here for Neva Medical Center. The flu vaccines, that the flu program that we have over here and how we administer it and how we evaluate the program after vaccines are administered. This is the competency that we are talking about here right now. If you conduct evaluation related to health education, how do we evaluate our programs? How do we make sure that our population can get the vaccines that we need? One, last year, what they did in the previous season was to open up different spots on Neva Medical Center San Diego campus to make sure that people who are passing are able to walk in there, fill out the paperwork and get a shot, and are able to upload into the health record. That is one thing that they did this year. One thing that we also after evaluating previous season's report, realized that there were still a few people that they missed even undertaking this step. So one thing that they actually have put in place for the coming season is to develop those spot centers, but also to develop like a drive-through. We have a flu season drive-through where we'll give you the documentation to fill online, but you print it, so by the time you get to the spot, we already have the paperwork printed and all the questionnaires answered. So you take it, we review it. If you're good to go, we give you the shot and we are gone. And we can do this at vantage points, at the entrances, at the exit of the hospital, and places that we have high traffic. So place that we do not have high traffic, so at least people can come in and out as and when needed. Whilst we are also doing that, we are also working through each department, each directorate, each division, finding reps in each division to make sure that all the people in their division receive the flu vaccine during the flu season. So that is the new intervention that we developed after evaluating the previous season's program, and we realized that it is going to be very effective. Well, let's hope it is more effective than the previous one, because we've added a few things to this upcoming season which were not present in the previous season. The next one here is the vaccine administrators competency assessment. So whilst we are making sure that the people are answering the questions properly before they come for the flu vaccine, we are also training the people who actually administer this vaccine so that they know what they are doing. Last year, the people who were vaccinated, who were educated to undertake these vaccine administration, they had some shortfalls along the line. So we also had to develop another program this time around to make sure that the people who want to administer this vaccine are people who have the right training and are able to administer the treatment as and when needed. What we did here is to create an assessment form, to create like an SOP, standard operating procedure, where the people come in, and once we train them and we are able to check off on all the competencies that they have to achieve to be able to administer the flu vaccine for that period, then we certify that they know at least the basics of administering the flu vaccine. We are doing this for as many as possible people, so that we will have a lot of people available to administer the vaccines. So at least we will have more people vaccinated this season than they were in the previous season. All right, so this is competency 2 under MPH competencies, and this one is to serve as a health education person. This competency is to prove that I can serve as a health education person. The first, I have two documentations for this, which are all related to fitness enhancement. One is education point regarding nutrition education that I delivered for my group of fitness enhancement personnel that I was undertaking. So as it were, before you take any group on any activity, you have to be able to educate them so the group will know their expectations, the things they need to do, where they stand, and what resources are available to them. That is what we did. That's what I did in this particular instance. We have the Navy's guideline for nutrition. What we do after in the presence of a nutritionist is educate these patients, educate this personnel who have this special cravings for certain kinds of foods, and how it is going to affect their achievements of their fitness goals. So one program that I actually developed was one that has to do with we call Eat Right. And this is as part of people who have certain cases of addiction to certain kinds of food, especially pizza. We realize a lot of people are addicted to pizza. I don't know how to get your head around that, but it's very true. People are so addicted to pizza, and it's something. If you, especially, you don't know how you to stay away from such addiction. The only thing that helps here is to educate, and that was my role at that time. So we have this table that shows how much food you eat, how much calories you actually take in, and how much exercise you have to do to burn a certain number of calories. So by doing so, you conscientize the people who are eating these kinds of food to know that, okay, so if I eat one slice of pizza and I'm taking about 600 calories, and to be able to burn 600 calories, I have to ride on a bike for about maybe an hour or 2 hours, depending on my speed. Then I'm going to think again when the next time I'm eating a slice of pizza. Or if I eat a slice of pizza, I have to run continuously for about 30 minutes to be able to burn about half the slice of that pizza. Then it's gonna help you to think about the food that you are eating. And that strategy that we took was actually very helpful. We realized that more people were winning from themselves from certain foods that they were addicted to into a more nutrition conscious meals that we felt were very important, and this started showing in their performance, in their and how they actually carry themselves around. And some of them actually confessed that it was hard to do, but in the end it is really paying off. All right, so the last document that I have verifying that I serve as a health education specialist is the Command Fitness Leader certification. This is a huge certification in the realms of Navy that people who know about fitness issues in the Navy will know the broad spectrum of activities that we undertake here at, in the Navy, especially when it comes to fitness. So to be able to achieve this competency, you have to undergo this 5-day intensive training regimen, coupled with learning, with seminars, with examinations, anything from activities, those that are contraindicated, those that are good for targeting a certain portion of your body. Like I said, this is the training suited for personal trainers, or those who train the Olympic personnel, what they call the strength and conditioning specialists. So it is very important that once you have all this certification, you're able to educate the people that you have, and that is what we did. So to be able to educate, to have somebody do a certain kind of activity, the person must know the risks involved and the benefits involved in that too. One thing that we do is, before we do an activity, we will demonstrate. We will tell you, if you do it this way, this is how you are going to benefit from it. But if you don't do it the way we are showing you, and you do it in a certain way, then of course, certainly it is actually going to cause some kind of problems for you. So these are the education points that we give to the people that we train, and it is very important for you to know that for the people that we always work with, it is very salient that we understand what we are actually doing, and for them to know that we know what we are doing, and for them to trust us and to do the things that we ask them to do. So all in all, this internship that I did and the work that I do has helped me to achieve these 3 foundational knowledge competencies, 3 workforce domain competencies, and 2 public health specialization competencies. So thank you so much for your time. It's been almost 48 minutes. Thank you so much for your time, and I hope you have a great, wonderful day. Thank you. Bye-bye.